myself first. I am Lorjan Faith Puliran, a BS Criminology student of Jose Rizal Memorial State University. So for today, I am going to tackle on how to get rid of the coronavirus. The COVID-19 pandemic has been a part of our daily lives since March 2020. But with about the increasing number of cases a day, it remains as important as ever to stay vigilant and know how to get rid of this virus. The best way to prevent illness is to avoid being exposed to this virus. As the vaccines continue their rollout, here are the simple steps you can take to help prevent the spread of COVID 19 and protect yourself and others. This highly contagious virus appears to be most commonly spread during close within 6 feet person to person contact through respiratory droplets. The means of transmission can be through respiratory droplets produced when a person coughs or sneezes or by direct physical contact with an infected person, such as shaking hands. So, number one, practice social distancing. Since close person to person contact appears to be the main source of transmission, social distancing remains a key way to mitigate spread, maintaining a distance of approximately 6 feet from others in public places. This distance will help you avoid direct contact with respiratory droplets produced by coughing or sneezing. In addition, studies have found that outdoor settings with enough space to distance and good ventilation will reduce the risk of exposure. Next, number two, wash your hands. Practicing good hygiene is an important habit that helps prevent the spread of COVID 19. Wash your hands often and with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% of alcohol. Cover all surfaces of your hands with a sanitizer and rub them together until they feel okay or feel dry. Avoid touching your eyes, your nose, and mouth with unwashed hands. Okay, so next is number three, wear a mask. Face masks have become essential accessories in protecting yourself and others from contracting COVID 19. By wearing a mask that covers your mouth and nose, you will reduce the risk of serving as the source of disease spread by dropping your own droplets in the mask. And also, reduce the risk of getting sick via droplets that contains the coronavirus by blocking access to your own airways. Okay, number four next is restrict your travel. Traveling can increase the spread of COVID 19 and put you at risk for contracting the disease. The CDC advises people to weigh the risk when it comes to domestic travel. Staying home is the best way to protect yourself and others from COVID 19. For people at risk for the complications of COVID 19, those who are older, it's prudent to avoid travel. You must travel. If you must travel, take safety measures considered or made of transportations and stay up to date to the restrictions that are in place at your destination. Okay, adhering to the DOH quarantine rules after traveling, you may help prevent the spread of COVID 19. Okay, number five and the last one, watch your symptoms. The symptoms of infection for the coronavirus are often similar to those of other respiratory virus infections. such as influenza symptoms. Okay, these are the symptoms include fever or chills, cough, shortness of breath or difficulty of breathing, fatigue, muscles or body aches, headaches, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. If you think you may have been exposed to a person with COVID 19 and have symptoms, call ahead to a doctor's office to see if you can get tested. So, these are the things that we should aware of in order to get rid of COVID-19. So, I guess that's all for this video. Thank you.